completion of it and selection, programming by the community organizations will start around June of this year. This is a very important step for the county to be taking, given where everything stands. It's a strange day that we're fighting for access to something as basic as contraception. I want the community to be able to focus on their priorities, on their goals, on their families, not to feel like they can't plan their families because they can't make important decisions because they don't have adequate access to the resources that they need. This isn't a fight we asked for, but it is a fight we will fight on behalf of the community. Let me repeat my remarks in Spanish and then pass it on to Dr. Brown. Estamos aquí en Planned Parenthood y quiero darle las gracias a ellos por recibirnos el día de hoy. Esto se trata de apoyar a organizaciones pequeñas en la comunidad y quiero notar el hecho de que Planned Parenthood ofrece el tipo de servicios que queremos apoyar: anticonceptivos, detección de enfermedades de transmisión sexual, educación sobre planificación familiar, etc. Planned Parenthood en este momento no puede ofrecer abortos, pero sí proveen este tipo de servicios básicos y de hecho yo he visitado Planned Parenthood para recibir ese tipo de servicios de salud absolutamente básicos. Recordemos dónde estamos. La ley que prohíbe casi en su totalidad el aborto tomó efecto el año pasado, aquí en Texas. Esa ley prohíbe el aborto desde el momento de fecundación, con excepción solamente para emergencias médicas que ponen en riesgo la vida de la paciente. Proporcionar un aborto es ahora un delito grave. Puede llevar aún la vida en cárcel o inclusive $100,000 de multas. Los doctores están hablando acerca del problema que esto representa, las mujeres están diciendo lo mismo. Sin importar cómo se sienta usted acerca del aborto, sé que muchos de nosotros estamos de acuerdo que el gobierno no debería ser quien toma esta decisión. Usted, su iglesia, su doctor, su familia, es ahí donde pertenecen ese tipo de decisiones. Como tejanos, estamos orgullosos de nuestra independencia. Aquellos que impulsaron la ley que prohíbe el aborto también ahora están impulsando los esfuerzos para prohibir los servicios de anticoncepción. Con la prohibición del aborto, más y más tejanos están buscando servicios de anticoncepción. Hemos escuchado también de los proveedores, las clínicas, que ven más personas buscando estos servicios. El 2010 es el último año en el cual existe esta información, pero en aquel año 54% de todos los embarazos fueron sin planear. Entonces me enorgullece presentar este programa de $6 millones para ofrecer atención médica vital en nuestra comunidad y preservar la independencia de nuestra comunidad, aún en frente de aquellas personas que prefieren que el gobierno tome estas decisiones. Este programa de $6 millones busca apoyar el acceso a servicios anticonceptivos, a educación sobre planificación familiar, exámenes de salud previos a la concepción y pruebas, prevención y educación sobre enfermedades de transmisión sexual. El programa tiene dos pedazos. El primero es expandir los servicios. Son fondos que irán al Departamento de Salud Pública del Condado Harris para ofrecer más servicios vía sus 3 clínicas y su clínica móvil, y además apoyar organizaciones en la comunidad para ofrecer ese tipo de servicios, para expandir sus servicios, inclusive más sedes. La segunda porción del programa es publicidad de apoyo, es ofrecer a las comunidades de bajos recursos, comunidades con bajo índice de seguro médico, información acerca de que estos servicios existen y existen a bajo costo o sin costo. En total, $5.3 millones irán a la publicidad, al trabajo. En sí, $700,000 será para administrar el programa y las logísticas del programa. El programa, la meta es impactar 20,000 residentes y también trabajar con 20 organizaciones comunitarias. El programa va a tener un lanzamiento por etapas. Mañana votaremos ese programa en la Corte de Comisionados. Si se aprueba, veremos un comienzo en las inspecciones de estos servicios en el Condado Harris, dentro del Departamento de Salud Pública, inmediatamente. Luego, el Departamento de Salud Pública va a llevar un proceso competitivo para seleccionar las organizaciones que van a recibir estos fondos, el resto de los fondos, y esas organizaciones comenzarán a invertir los fondos empezando alrededor de junio de este año. Este es un paso muy importante para que tome nuestro condado, dado dónde está el estado, dónde está la situación de este tema reproductivo. Es un día extraño que estemos luchando por el acceso de algo tan básico como la anticoncepción. Yo quiero que la comunidad pueda concentrarse en sus prioridades, en sus metas, en sus familias, no sentir que no pueden planificar sus familias, como si no pudieran tomar decisiones importantes, porque no tienen acceso a los recursos que necesitan. Esta no es una pelea que pedimos, pero sí es una pelea que pelearemos en nombre de nuestra comunidad. Thank you so much. And we'll hear now from Dr. Erica Brown, Harris County Public Health's Director of Community Health and Wellness.
Thank you, Judge. Harris County Public Health is excited at the possibility of expanding the capacity to provide free reproductive health services for our community. We have several clinics and a mobile health team that moves out into the community to provide these services, including free gynecologic exams for women, free breast exams, free sexually transmitted disease testing, and certainly outreach and education around family planning. So again, we are excited about the possibility of being able to expand our services as well as providing capacity through micro grants to the community partners who are already doing great work in these smaller, vulnerable areas. And with that, I will turn it over to Dr. Kumar. Thank you.
Good afternoon. Planned Parenthood is a leading community provider for judgment-free, comprehensive sexual and reproductive health care in Texas, as well as a vital resource for medically accurate education that advances the understanding of human sexuality, healthy relationships, and bodily autonomy. We see all people, regardless of income, insurance status, gender identity, race, immigration status, or sexual orientation, because we know all people need access to respectful, compassionate healthcare. This is who we are, and this is what we've been doing for decades. Unfortunately, we have seen relentless attacks on healthcare providers like Planned Parenthood, precisely because of who we are and the type of care we provide. Years of attacks on sexual and reproductive health and education, a lack of comprehensive health education in our schools, and the most recent gutting of abortion care in the state have left the people of Texas in an avoidable and unnecessary predicament as they struggle to find the health care and information they deserve. Today, as Planned Parenthood has done for decades, Harris County is stepping up to fill the gaps in the care that the state has created, affecting our county's most marginalized people. Despite today's hostile environment towards reproductive health care, Harris County is putting the needs of our community first. By providing this much-needed $6 million in funding, healthcare providers like me can expand our ability to provide a full range of options for contraception, including the most effective options like IUDs and contraceptive implants, testing and treatment for STIs, and educational programs that help empower our community and connect them to care. We will continue partnering with the county to meet the needs of patients and ensure that our community still has access to crucial reproductive health care. We know that when people have access to the health care and education they need and deserve, they can show up as their full selves for them, their families, and our community. Thanks.
2 quick points as we go to questions. This is Women's History Month, and that is one reason why the judge and I want to do this today. Second point, there are a lot of places we could have picked Angie and Dr. Kumar to have this press conference, but because of the relentless attacks on Planned Parenthood over the years and the great work you have done over the years, my staff asked me, where should we go? And I said, is there any question? And Judge Hidalgo, thank you for coming. Questions? We hit it all? Yes.
Hi, yes, so just, I don't know who's best to answer this, but the landscape, you talk about the gaps, filling the gaps. Can you explain kind of the situation and how it is now and how this money will change it? From, a person's perspective who needs this healthcare, what will they see different because of this money?
So what we've done is highlighted specific zip codes around the county where there's high social vulnerability index and a high rate of, or a low rate of insurance, access to insurance. There are some services out there. There are clinics, there are organizations, some large ones, some small ones, that provide access to contraception, to STI screening, to these kinds of services. But there are two challenges. First, sometimes these organizations, the ones that are deep in the community, in the areas where there's a lot of uninsured people, a lot of folks who truly need these services because they cannot afford them otherwise. Those organizations are very, very small and don't have the funding to provide to serve the need that's out there. Sometimes they do have the capacity, but the community is not aware that these services are available at low cost or no cost to them. And so what this will mean is specifically in those zip codes that we have selected, and the Public Health Department can make them available after the fact, there will now be increased capacity for the organizations. Obviously, after they compete, some will be selected in these zip codes to provide more services, and there will be increased awareness of the fact that these services exist. And so, anecdotally, we have heard from these providers that they're seeing increased demand for these services, and we can only imagine if things continue to go in the direction in which they're being pushed, with folks threatening contraception just as they came after abortion, that there will be more of a need than for these kinds of services.
So the money, is it all funneled through Harris County Public Health and then it's distributed out?
Exactly. So part of the funds are going directly to Harris County Public Health, $700,000 for Harris County Public Health to increase its own programming in terms of these services, because Harris County Public Health provides these services in 3 clinics, in one Antoine Clinic, one in Humboldt, and one in Pasadena. And they also have a mobile health clinic that provides these services. So they're going to expand that provision of that because it goes specifically to these areas. The sum of the funds is going to, or sorry, that $700,000 is for the administration of the program. Then another portion of the funds is going to expanding Harris County Public Health programs, and then the balance of the funding is going to grants for these other providers. So Harris County Public Health will work with a purchasing department, put together requests for proposals, invite these various entities to apply, and by the time the selection process is finished, the implementation via these other organizations will begin around June of this year.
Do you have an estimate for how much that is?
Yes, so I'm trying to find exactly how much is, I believe it's 1.1 is for Harris County Public Health, 1.1 million is for Harris County Public Health, so the other 4.2 million around is for the other organizations, 700,000 is for program administration and logistics.
Where does Planned Parenthood fall in?
So Planned Parenthood provides these services, and they this is intended for smaller organizations. Probably Planned Parenthood would not qualify to apply for this grant. However, Planned Parenthood does provide these services, and we wanted to hold a press conference here so that folks are aware. Back to problem number 2, some folks need these services and don't access them because they are not aware that they're out there. And so there's, Planned Parenthood has very much been maligned. It's been attacked, and we want folks to know that they are providing these very vital basic healthcare services, and even within all of the attacks in the state, and very, very valuable services, and services that folks around the community, around this area, need to be aware exist. Hopefully this will also help us reach those smaller organizations that we hope will apply. So that's why I'm grateful to Planned Parenthood for allowing us to be here and sort of use that platform to say, hey, we're looking to expand those kinds of STI screening, family planning, contraception, basic health services.
Where's the money coming from?
Oh, the funds are coming from the American Rescue Plan. It's actually the anniversary of the American Rescue Plan funding. So we're in the 2nd anniversary this year. So these are federal funds. We are at this point hitting $150 million that Harris County has invested from American Rescue Plan funds in families and children, and that is through our early childhood program, supporting attacking maternal mortality. All kinds of initiatives, the child tax credit, this supporting children and supporting families.
And I know you mentioned a series of different things that this money could go to, services, contraception and things like that. And you also
I will leave that for Dr. Brown. Yes.
Yes, thank you. So Harris County Public Health does not specifically provide direct fertility treatment. We do provide education around family planning. And with regard to the micro grants, we would be open to see what the community providers would propose and then make the selections from there.
So it's a wide range of possible options from contraception to different types of families.
Yes, we are absolutely looking for our smaller providers and our partners in the community to provide innovative solutions to make sure that we're addressing the need for access to reproductive health care, which does include fertility and family planning.
What would you just say to a family out there who's hearing that $6 million is coming to our county and they want to figure out how maybe they're in the phases of planning a family or not planning a family? What would you say to them? And just be patient, this money's coming out, this money can help you. What would be your message to them?
Sure. So immediately, Harris County Public Health provides free service today. You can access our website and call for an appointment at one of our locations, and we do provide free gynecologic exams in preparation for family planning. We provide family planning counseling. We provide contraception. All of those services are available today. So we don't have to wait with regard to provision of some access. What we are looking to do, though, is to expand the access to those vulnerable populations in those areas where we know that there is a higher social vulnerability index, we know that there is a higher rate of uninsured, and we are looking to be able to take those services closer to those who have a need.
Angie, you want to add to that? Because if they call my office, I'm going to say call Planned Parenthood.
I will, yeah, thank you. Yeah, I would just add, and Dr. Kumar certainly said this earlier, but we have been providing these services, access to STI testing and treatment, birth control for over 85 years in the Houston and Southeast Texas area. We continue to provide those services. We also have gender-affirming hormone therapy and trans care services. Anything that you need for your sexual and reproductive health care, you can come here to any of our 6 health centers in the greater Harris County area, including also in Fort Bend and Montgomery County. We've got health centers that can serve folks. We also have services by telehealth. So we are here to serve our community and make sure that people are getting what they can as best they can.
And I guess could they partner? So if it's a small organization, can Planned Parenthood partner with them
I think
through the RFP process? I just want to make sure we don't leave you out. You could partner
yes, would love to partner.
with their micrograms.
Yep.
Any other questions?
Good. All right,
Thank you.
Thank you so much.
Thank you.
Thank you. Thank you so much.
How you doing?
Good. Yeah, you?
Yes.